This podcast is, what is it all about? I think Dr. Saab is going to be in a very good position to explain all that. So, Dr. Saab, most welcome in our brand new podcast. How are you doing?
Very well, thank you. This is exciting. New beginning, as they say. We're reinventing ourselves and rebirth.
So, Dr. Saab, let's start with you. Tell us something about yourself.
Yeah, I think, as you know, we've been doing our show for good 5-7 years. But during this journey, I've been constantly thinking, what can we do to make the most contribution where people are healthy? And that journey, I'm a medical doctor, health practitioner over 50 years now, and consultant for over 45 years with Fraser Health. So all this has convinced me that we need to reach out to people. So this is what this podcast is about. In terms of introduction, I'm a medical doctor, a physician with a PhD in biochemistry, and MD from University of British Columbia, fellowship from Royal College in biochemical medicine, and extensive experience at all levels of policy and process and practice.
So, I think you're the right person to start this podcast.
I think so, because not only I have the experience and the expertise, but reason I'm most importantly right person for it, because I have a passion for it.
Yes.
It's coming at the right time of last 15 years of my journey, where I got engaged with the community, and I was shocked when I found out that our community has such a high preponderance of chronic diseases. Most people just laugh at it or just say, yeah, so what? As a matter of fact, in India, they were very proud that India is the capital of diabetes. To me, my passion was, this is not right. We have to do something about it. And so that's why I am the right person. Last 15 years of journey, we decided that we are going to do something and do it right in our backyard, Sushmaji. So first thing I want to share with our listeners and viewers is what we have done in 15 years, what we have put in place, that we are in a position to have this podcast.
And we're going to call this podcast You.
So what I want to say is, you and your health.
Right.
It's up to you.
Yes.
And it's still a gup shop, because you like to have very informal conversation,
Yes.
though it's serious matter.
Of course.
So gup shop with seriousness.
Yes.
So gup shop between Sushma ji and Dr. Ji.
Beautiful. I love that.
So there is a rhyme. And then it's about empowering,
Yes.
educating, and engaging for better health. So this is what this will be all about. And hopefully we'll do 4 or 5 episodes and reassess it, and then see where we go with that after that. So it's about health promotion,
Right.
illness prevention, and chronic disease management, all lumped together with the emphasis on the person. And that is the difference we will be sharing.
That's a very good point, because I think majority of us need to look after our own health first and foremost.
Yeah, and I think what has happened is that somehow, as our healthcare system has grown, as our health availability have grown, people have kind of dependent that somebody else will take care. And this was a light bulb for me as I went into this journey. I said to myself, you cannot, and I repeat, we cannot lower the burden of chronic diseases. You cannot make society healthy because of others. It has to come from within. And we will talk a lot about it, because it really is very exciting fusion of the best of the East and best of the West. So not only it's absolute science and evidence-based and incorporates all the science of modern medicine,
Right.
of which we are a practitioner. But my journey has taken me into Indus Valley Vedic yogic science,
Right.
and how that plays into health. And Sushmaji, right at the outset, I was surprised when I started to read about that and learn about it, how big emphasis on all that is Indus Valley Vedic yogic science is essentially being healthy. It's not a religion.
No.
And it's not a philosophy even. It really is a prescription
Wow.
to be healthy. And I said, wow, why can't we then incorporate that knowledge, which is now close to 10,000 years old,
Yes.
into this modern science
Yes.
and come out the best of the East and best of the West? So, Sushmaji, I'm very excited that this is going to be the podcast.
Yes.
And we will have, as I said, we could go into specific diseases, but most important is we'll talk about lifestyle.
Yes.
And the parameters and the variations and mix that with science. So we'll talk about those in different episodes, and then hopefully people can incorporate this pragmatic, practical, outcome focused, and it's not even advice. This is not a prescription.
Right.
That's done by a regular doctor.
That's right.
But what I want to do is share the excitement, the knowledge with people, and have them kind of say, yes, I want to be healthy.
Right.
I want to do this. I can do it. I am healthy. So try to not only excite them, but try to make them aware. And this is where the word empowerment, which empowerment really is that you give power to somebody else. And that's what we want to do through these broadcasts. So I think as an introduction, it's fair to say that this will be a good experiment. We haven't done this before, and hopefully it will help. Even if one person able to be healthier,
Right.
it's all worth it.
So let's look at where we live. Let's look at how we can divide that into portions which are for our
So it's
business.
manageable and
Yes.
it's understandable, and it's really knowledge translation. And I think at the outset, I should say, and I will repeat it many times, disclaimer, because I am still a licensed physician.
Yes.
And this is not practice of medicine.
No.
It's not a medical advice.
No.
It really is sharing knowledge translation,
Right.
taking the science of medicine which exists and put it into information so people themselves become more aware. This is not a substitute for medical advice or seeking medical advice from their doctor. If anything, this should help them in better understanding what they're dealing with so they get better information to the doctor. So that's what it is. It's not a medical advice. It's more of a knowledge translation for our people.
So where we live in British Columbia and the healthcare system, our doctors, they are all overburdened. And I understand, and you and I were talking about this, that's 80-20 ratio.
Yeah.
I want you to talk a little bit about that if you can.
Yeah, so I think as a start, let's talk about what is this all about. So I think of healthcare system, which is, I think we are very fortunate to be living in this country where there is a public Medicare. There is, you don't have to worry about your pocketbook to be paying the medical bills, which I think is fantastic, universal, and I fully support it. But if you look at it, I think of it as first space is what I call institutional acute care.
Okay.
So that is care given to you in a hospital or acute care.
Yes.
So that's based on understanding of physical body, and that's what modern medicine in last, we are in 2500, started post-industrial, so around 1800.
Right.
So it's about 300 years old knowledge, which has really come big in terms of understanding what you see, the physical body.
Right.
And that is acute institutional care.
Okay.
And this includes all kinds of diagnostics, all kind of imaging, all kind of technology, and that is second to none. So we will not go there,
No.
part of this.
Yes.
Because that is very well done, and doctors are already doing it, and nurses are doing it, other healthcare providers are doing it. It's a team approach, which I call acute institutional care.
Perfect.
Then there is acute community care.
Okay.
So that is provided mostly by all my colleagues in general practice and family practice. That is the backbone of good health.
Right.
But still it's episodic. You go there because you have some acute episode, something not working, but it's provided in a community setting, in a doctor's office, and continuity of the care. And again, we will not be going there. That's provided by them. And we won't be even talking about all the challenges. It's a huge thing to manage those two spaces. It's a huge amount of work in public Medicare. Then there is towards the end of life, so there is long-term institutional care, where either in the institute or in the home, care is provided to you. Then there is palliative care, end-of-life care. So I think of the healthcare in those four spaces. That is interesting that at any given time, only about 20% of people are in that space.
Those four spaces.
Yeah, 20% to 25% of the people.
Maximum.
Yeah, because otherwise, most of the people are making a living, earning a living,
Yes.
their children, and going to school, going to business, going about their way,
Right.
which I call 80% of the people.
Right.
But the interesting thing is, and this is what this podcast is all about, we spend close to 80 to 90% of our resources in that 20% of the people. And that's where most of the activity is. But how do you engage average person who is still living day to day, going about earning a living, and still want to be healthy? And how do you bring the lifestyle in that to that 80% of the people? I have called it fifth space.
Fifth space.
Yeah.
You're like sixth sense and fifth space.
Yeah, exactly. So this is the fifth space, which will be mostly formulating in our podcast in different places. So it really is a direct call to the people directly in that 80% of the people essentially in healthy space, but they're also living with chronic diseases. So when they have acute illness, they go to the hospital, they're looked after, but then they have to come back and live with that. They go to their doctor's office, but then they have to come back and live. Where is the support? Where do they get information to be able to cope with those things? And I think that will be part of our podcast as we go along. Then there are a lot of community services. So in my journey in last 15 years, I felt that this is the space I want to contribute.
Right.
And that's what we've been doing. So first we formed Canada-India Network Society.
Yes.
Because we wanted relationship with India and Canada and health, which we have done very well. Our next meeting coming up next year, we'll talk about that. And then we formed a 50-year legacy South Asian Fund at Royal Columbian Hospital Foundation to support some of this 50 years legacy, kind of represent my 50 years in Fraser.
Yes.
Then I'm very proud is that in Fraser Health we established South Asian Health Institute.
Yes.
Because we talked about lifestyle, but in this whole milieu, culture was left out. So people never consider culture as a factor of health. And to me, that's the biggest factor. Culture brings the individuality. Understanding of the culture brings that understanding, I want to be healthy. And this is where we could learn a great amount from our First Nation people. Because if you look at their concept of health, it's all about wellness and it's all about culture. And if you look at Indus Valley Vedic, yogic science, it's all about wellness and understanding of the person, so the culture. Doesn't matter what culture you come from, it's very individual.
If you look at it, all the indigenous people of entire world are connected to nature.
Yeah, absolutely. And we will bring that out because it's beautiful that their understanding of health is connected to Prakriti. The
Right.
Hindi word is Prakriti.
That's right.
And then go a little deeper, the 5 elements
Yes.
of water, air, and fire, and I think space.
And wood.
So I think there are a lot of similarities. But what I have done in last 15 years is incorporate this to be healthy. So it's all about health. I don't want it to be philosophy or religion or abstract thinking. It's very practical, down to earth, how to be healthy and how to understand your health and then how to live it. And that's what our podcast will be all about. And this incorporates, you asked about my journey. Biochemistry is beautiful because people don't realize, or maybe they realize, but they don't fully appreciate, a biochemical physician thinks of you as a person.
Yes.
Because I'm not a specialist in heart, I'm not a specialist in liver, I'm not a specialist of brain, I'm a specialist of your whole body.
Right.
Because that's where all the reactions are taking place.
That's right.
You know, if you look at our body, essentially we eat, we sleep, we exercise, we go to work, but the body is moved by energy.
Right.
And that is called biological energy. And biochemistry really is how that biological energy is produced.
Right.
So I think I have incorporated all this in our thinking now. It's like a light bulb going in terms of. So I'm very excited to be able to share that with listeners of this great show and also viewers. And also we are doing conferences. So we are going in many different directions to carry this message. And the sole purpose of this is to build healthy society. What our motto of CINS is building healthy civil society, and we'll be doing that. So I think that's what we'll be doing in the podcast. To be focused, so first we talked about the spaces.
Yes.
And so we'll be only in 5th space.
Right.
So it'll be a direct translation, knowledge translation, empowering and educating the individual
Right.
and the community in their own health. Then to start out with, we'll have lifestyle event because lifestyle plays a major role in health promotion, illness prevention, and chronic disease management. So you go and see your doctor, you go in the hospital to look after the acute illness, inflammation, illness, infection, whatever. But then you have to live with that on a day-to-day basis.
Right.
And the 4 key elements of lifestyle rotates around food or
Yes.
nutrition
Yes.
or exercise or movement or emotions or stress, and most important, sleep to recharge.
Yes.
So those are the 4 elements we'll be talking in some detail each episode to empower individuals what that means and how using those they can then live a better life.
Now, each one of them are important. What are you going to start with?
When?
What are you going to start with?
Today, I think today was introductions. I
Right.
think we have done
and
this.
then next podcast.
Yeah, we'll start with food, my favorite.
Your favorite?
Yeah.
My favorite too.
Yeah, and then we'll talk about our 5Ks.
Yes.
And then we'll talk about understanding of the food.
Yes.
And we'll talk a lot about when you eat, why you eat, how
Where
you
you
eat,
eat.
and how much you
Yeah,
eat.
that's right.
Then we'll talk about what you eat.
Yes.
And in that, we'll go in deeper in terms of understanding of the food and different components of the food. So I think that will be very practical.
Dr. Saab, this is a very good introduction to what we want to do. And I want to take this opportunity and thank you, first of all, to think about it and bring it to this very concise and understandable, format
Yeah.
so that people can see it, listen to it, and also comment about it.
Yeah, that was the most important thing. Is hopefully the medium we use, there will be enough input from people that it makes sense, and how we could make it better so that it's more meaningful to them, because it's pre-recorded. So then I think there won't be any live questions, but hopefully in today's technology they can set comments and things like that, then we could incorporate those.
Thank you.
Thank you.